Hi there to Sidmouth and College and Schools. My name is Suzanne Brown and Miss Prince has asked me to tell you a little bit about my job. Now, I'm a radiographer and I work in the CT scanning unit at my hospital. Now, when I was at junior school, I knew that I wanted to work in a hospital so that I could help people. But I also knew that I didn't want to be a nurse or a doctor. I was always good at physics and science, so I started to look for a career that would involve using these subjects. And I came across information about a job in radiography, and I decided that I would look into it, and then decided that that's what I wanted to do. Now, I'm sure some of you will have broken a bone at some point, and you'll have had an x-ray taken to show where the break in the bone was. Well, that picture would have been taken by a radiographer. That's someone who takes x-rays. Now, radiographers work all day and all night. Taking x-rays, we sometimes go up onto the ward if a patient's too poorly to come down to the department. We even go into the operating theatre. Now, if you've had a broken bone in your arm or your leg and they've put a metal pin in, then we would have been in the theatre taking x-rays to make sure it was in the right place. Now, you know that there's more to the body than just bones. And radiographers use different methods to look inside the body. Now, when your mum was pregnant, she would have had an ultrasound scan to see that the baby was growing okay. There's MRI, which uses a very powerful magnet to see what's inside the body. There's something called angiography, which they use to look at the blood supply to your body. There's nuclear medicine, which uses different radioactive substances to see what's going on in your body. And then there's CT scanning, which is what I do. Now, CT scanning looks like a big donut-shaped machine. When it starts scanning, it sounds like a plane taking off. So what happens is you lie on a table, the table moves up in the air and then moves in and out of the machine. And it takes about 20 seconds to do a scan of the whole body. Then the radiation passes through your body and it shows up on the pictures. Now, bone lets a little bit of radiation through, but fat and muscles let more through. So what happens is you get a black and white picture. And it's just as well, because a coloured picture would be a bit gory. The scanner has a very powerful computer, takes all the information, and it makes lots of pictures of slices through your body so we can see what's going on inside. So this is the CT scanning room. So over here you see our injecting machine so that we don't have to be in the room to give injections. And this is a very special x-ray machine. This is called a CT scanner. And what this does, it takes x-rays of different layers in your body and it helps us to see what's going on inside. Now, when I scan a patient to see what's going on inside their body, I have to give them an injection of something called iodine contrast. And what this does, it helps to show up different organs inside the body. Things like your liver or your kidneys, or we can see inside your heart or your arteries or in your lungs. Now, it makes people feel very hot and it gives you a horrible metallic taste in your mouth. The best way to describe it is if you've ever had a chocolate and some of the metal foil has been on it, it tastes like that if you've got the metal foil in your mouth. Now, my job is to make sure that people get the right scans to show what the doctors need to see. Doctors who read the x-rays are called radiologists. Now, I also teach students who are learning how to take x-rays, and I also teach radiographers how to scan specialist scans, especially looking at the heart or looking inside the bowels. Now, I love my job and I've been doing it for 38 years, which sounds like a very long time. I get to meet lots of different people and help to find out what's wrong with them. Now, the worst part of my job is that I get to see what's wrong with patients before they find out what's wrong. The easiest part is taking the scans. And the most difficult thing is when you see someone who's very, very sick and you know that they're probably not going to get better. Now, how do you become a radiographer? Well, you go to university for 3 years. You have to know anatomy really well, and that's knowing where everything is, what it does, and whereabouts inside the body it is. Now, when you qualify, you decide what part of radiography you want to do. For me, it was CT scanning, and then it takes you another year to learn the basics. But you know what? Even after 38 years, I'm still learning, and I'm still taking courses to find out how to do different parts of my job. I think it's a very interesting job, a very interesting career. So when you think about a hospital, don't just think doctors and nurses. There are lots of other jobs in there as well, like me, a radiographer. Well, I hope it gives you a little bit more information about radiographers and about the different things that we're involved with. And I wish you all the best. Bye-bye.